Good morning, everyone.
Good morning.
Welcome. Good morning.
Good morning.
All right, it's
Good
9 a.m.
morning.
Welcome to this webinar series. This is the second of a type to mark the month that we celebrate or we commemorate the activities to do with World Anti-Counterfeit Day. We already had the first one on 4th of June, where we went through the various aspects that concerning what happens when we have substandard products and counterfeit products. Today, we wanted to pick on one pillar of how we can take care and control presence and the effects that we could have in our supply chain concerning substandard and fake or counterfeit products. To do that, we have lined up what we are calling Introduction to Serialization, Track and Trace. We have lined up several aspects that you're going to get into shortly. But before I do so, my name is John Mwangi, and I am representing Kenya Association of Pharmaceutical Industry as well as Regulatory Affairs Professional Society of Kenya. I would like to hand over the floor to our chairperson for Kenya Association of Pharmaceutical Industry, Dr. James Mukoro, to do introductory remarks, and then we will take back the program to introduce our speakers. Over to you, James.
Thank you very much, Dr. John. Good morning, everyone. My professional colleagues, ladies and gentlemen, with all protocols observed, I'd like to take this opportunity to welcome you to today's webinar, where we'll share knowledge, learn on this very important aspect of track and trace. With us today, we have various partners in this journey. To start with, we have Pharmacy and Poisons Board, we have Counterfeit Agency, we have Kenya Pharmaceutical Distributors Association, we have RAPSK Kenya, represented by John, we have PSK, we have MEDAC joining us today. So I think I'll go straight to PBB, where Dr. Toroitich, you'll give your opening remarks, and then we proceed to the next partner association. Back to you, Dr. Toroitich.
Thank you, Dr. Mukoro, and thank you, the team from KAPI that has organized this meeting. Thank you. And I really appreciate and honor your invitation to this meeting and the collaboration that we're having with you with regards to the fight against substandard and falsified medicines in the country. I think it's something that is at the heart of our regulatory system strengthening, and I want to thank you for giving us this opportunity. Following all protocols, I just want to introduce myself officially. I'm called Anthony Toroitich. I'm Director of Corporate Services at Pharmacy and Poisons Board. That directorate is charged with the responsibility of just strengthening the regulatory system at PPB, which is cross-cutting across all the functions. For this meeting, I think I just want to reiterate that PPB is in support of a traceability system into the country. I know we have a lot of stakeholders discussion, and then we still are hoping to have more discussions about it. But just to give a glimpse of what the country is, where the country is heading, is that the government through BETA has what we call several pillars, and the main pillar on digital health is to facilitate a digital health superhighway through health information exchange system. And in that health information exchange system, there is an aspect of facilitating traceability of health commodities from the source to end user at the point of sale. So there are a lot of discussions that we are having with DHA and also at the ministry and also at PPB level with WHO in terms of also the requirements of GBT of maturity level 3 in terms of batch traceability. So there are a lot of things going behind the scenes to look at it, but we are aware that there are a lot of implementational issues that needs to be resolved fast. So our head of ICT is going to present to you what we are doing and how we envision the track and trace and authentication and traceability system as envisioned by PPB. To just give you a glimpse of what we are planning to do, and then we are aware that it has also political connotation in terms of increase on medicines, pricing, but we want to implement it through a phased approach. And just to reiterate that, I think we really need your support in how we are going to implement this. This is a very important intervention in the fight against, especially for us. I think the biggest problem we have is the fight against substandard and falsified medicines, but in particular substandard medicines, because we are really having issues. And I think we are aware that of late, we have seen a lot of recalls coming from PPB, and people are wondering what is happening. Those are effects of us trying to achieve maturity level 3, because and those ones are going to be many recalls, because the issue of substandard medicines is a big problem, and we really need to also handle it the same way we are discussing about falsification of medicines. So we are looking at the whole spectrum of strengthening the post-marketing surveillance, which is one of the core areas that has been neglected. I think the main area has been the focus of our regulatory system strengthening has been on pre-market strengthening, which has now become quite robust in terms of licensure of premises, licensure of pharmaceutical personnel, and licensure of products and authorization of products. I think that one has now become a bit robust, albeit a lot of small challenges, but I think majority of it is now robust. The one that we really want to strengthen now and we are focusing on is now what happens, the interventions that occur after authorization of marketing authorization, and that is post-marketing surveillance. We have successfully implemented the pharmacovigilance system, which is quite a learning, and we are trying to inbuild that into strengthening the post-marketing surveillance. We have a project on near-infrared field detection technologies, and on all that are geared into quick response to substandard and falsified medicines in the field. So I think with that, I just want to welcome you all into this meeting. PPB is very excited with this partnership, and then we are going to continue engaging. I know we still have to have other stakeholder meetings, especially before rollout. It's something that we are going to discuss, but I think most of it you are going to get a clear glimpse of where we are heading once Remy, our head of IT, presents. Thank you and welcome. Over to you.
Thank you, Dr. Toroitich. Thank you very much. Next, I don't know if we have representative from Anti-Counterfeit Agency authority that we are partnering closely with in terms of the fight on falsified medicines. Anyone from Anti-Counterfeit Authority? All right, silence means they are not yet joined, but as soon as they do, we'll recognize them. Next is PSK. Do you have a representative from PSK, Pharmaceutical Society of Kenya? A professional association? Right, maybe they are joining in due time. KPDA, Kenya Pharmaceutical Distributors Association. Dr. Muricho, are you in? Just unmute and speak. Not yet. We can go to MEDAC. Steve Kipkoti. Chair.
Good morning. Good morning, Dr. Mkoro. Good morning, all attendees, ladies and gentlemen, all protocols observed. On behalf of MEDAC, just want to thank you for all of the stakeholders who have been putting their hands and efforts towards this webinars, and most importantly, PPB for leading the initiative and driving the track and trace sensitization. We want to just commit ourselves as MEDAC to reiterate our position within the value chain, helping to strengthen the regulatory system, but most also give insights and support to the industry regarding health products and technologies, how best they can be implemented or rolled out for track and trace. It's a very important value chain, and the commodities also are traded or handled differently to some pharmaceuticals, given the ecosystem that they needed to operate. So we're happy or keen to see this development and the journey that we're going on, and looking forward to see the outcomes that will both strengthen the industry and most importantly, innovation for the suppliers and manufacturers, safeguarding that innovation, but most importantly, safeguarding the interest of the patient. So thank you for the opportunity, and we can remain committed and sold out for the cause of track and trace. Thank you.
Thank you, Chair Medak. I think also we have RAPSK, on behalf of RAPSK, John. I know you are wearing two hats. Just give an opening remarks on behalf of RAPSK.
Okay, thank you. I'll be brief. First of all, thank you all that have joined today from, the various organizations and institutions that you're representing on behalf of RAPS Kenya. This is an initiative that we are very keen on as regulatory affairs pharmacists. We are very keen on seeing how well this is implemented. Our members are keen to also add their input, and we hope that the insights that we'll get from here today would equip us to be even much better when it comes to advocating for the best way to implement track and trace and to see it to the end, that the products that get to the patients are of the right quality standards without necessarily causing any disruptions in the supply chain. So thank you for that, and looking forward to the learnings from here.
Thank you, Chair RAPSK. I am informed that the chair for KPDA is having trouble joining. I think as soon as he does, we'll recognize him. I think back to you, John. You can proceed with the rest of the program as we await other stakeholders to join, then we'll recognize them in due course. Back to you.
Sure. All right. Thank you. So today, our session will have several sections. Just quickly, we will hear from GS1 organization. I believe most of you here, if not all, have heard or interacted with GS1 organization in one way or another. So with GS1, we will be able to understand the technology, the GS1 standards. And after that, it will be followed by presentation from a company or one of the institutions that is currently implementing track and trace. I will introduce the team shortly. And shortly after, we will also get a chance to hear from PPB in detail when Gideon Muremi will join. So to start us off is a team from GS1. We will have Nuran, Idris, and Nelson. Nuran is a seasoned digitization, let's say so, expert, currently working at GS1, where she has over 10 years of experience in healthcare digitization, and recently she has also joined the GS1 Global Office. Nuran holds her qualification as a political scientist as well as e-health specialist. Together with Nuran is Nelson John, who is from GS1 Kenya, who has been working there for 7 years and acts as a team leader for industrial engagement. Nelson, in his role, he's responsible for promoting and supporting adoption of GS1 standards and solutions across all the sectors in the Kenya supply chain, including healthcare. That's where we are here today, but we'll also hear that they also do work beyond healthcare. With that, I pass on the floor to you, the team from GS1, to share your presentation. After you, I will come back to introduce Meryl and Sean from NBI. So over to you.
Wonderful. Thank you so much, John, and good morning, everybody. John, before we go ahead, can you kindly confirm you can hear me okay?
I can hear you. I do hope I represent everyone else. And we also see your screen in PDF version, I think, yes. So please take it over from there. You have 45 minutes for your intervention.
Wonderful.
All right.
Okay, all right. Right, so habari asubuhi, good morning, everybody. It's very nice to be here and to share with you a little bit about GS1 and how it fits in to support the traceability conversations. Again, I think it's very, very pertinent. This topic of traceability is very pertinent as Mr. Toretich, I hope I haven't butchered the name. He mentioned in his opening remarks how Kenya as a country is focused on this challenge of falsified medicines and trying to better secure the supply chain. And so what I hope to do, what Nelson and I hope to do over the next 45 minutes is to share with you a little bit about how the GS1 standards fit into that conversation. So as I'm not going to read that again, but I work with GS1 Global Office, and I'm here with my colleague from GS1 Kenya, Nelson, and we will be taking you a little bit about, again, global conversations around GS1 and a very specific focused conversation on how GS1 Kenya is positioned to support this conversation. So again, not to say it in so many words, but I think we are aware of the challenge of counterfeit and falsified medicines everywhere. What you see on the screen there is just a very brief screenshot of how, from the WHO. Actually, the source is hidden under the slide there. But this is a screenshot of how many recalls there have been, and this is from WHO, and it's only a screenshot, so it's not exhaustive. But what I also want to say here is how this challenge is global. It's not specific to Kenya, it's not specific to East Africa, it's not specific to Africa. It is a global problem. This is a screenshot again from the US FDA, equivalent of PPB for the US, and this is what they had reported. And before I get to that, I wanted to share with you these two very similarly looking medicines on the screen. And if anybody of you can tell me with 100% certainty which one of these is counterfeit, then please call me and send me your M-Pesa number. I will send you some money, I promise. Because I think it's realistically impossible to just take a look at the pack and be able to say, I think for some people, maybe it's possible. I think with experience, when there's very, very definitive, components that stand out, but normally as a regular consumer, you look at them, you can't tell. And I want us to really think about this challenge not only as health professionals, as KAPI, as pharmacists, as doctors, but really as patients, because I think I'm very sure every one of us has gone to a pharmacy, has gone to the doctor, and tried to get some medication. And the hope that we all have, I'm sure, again, is that the medication we're getting is actually the real one and not something that has been made in a store that is looking like this one here. So this is, again, real. There are medicines that are made in deplorable conditions, as you could see. And I don't think any one of us, no matter what circumstances, would want to get a medication that is from a facility like that. So this is really to say that the challenge of counterfeit is massive. And what I hope then again to tell you is how GS1 as an organization is attempting to address some part of it. And I'm choosing my words very wisely here. It's GS1 is not a solution for everything. It is a solution for a part of it. And what I will tell you again is what that part is. So GS1 is a global organization. It's a standards development organization, and in fact, it was accredited as an NGO by the UN ECOSOC in 2011, which means now GS1 is also a non-governmental organization. And the standards that we develop at GS1, this is just another number to tell you how many, where the GS1 standards are used all over the world. As you can see, there's dots pretty much throughout the map, and even that map probably is a bit outdated because there are scans everywhere. One interesting metric here is like there's 10 billion barcodes that are scanned everywhere. So the GS1 standards are used not only in healthcare. Healthcare is one use case. For those of you in Nairobi, you go to Naivas, you go to Carrefour, and you hear that barcode being scanned. There's a high percent chance that the scanning, that whole organization behind the barcode is facilitated by GS1. So that's really how far-reaching GS1 standards are used. So I'm going to be focusing on healthcare, obviously. But before I get to a little bit more about what the standards are, I wanted to tell you again that how GS1 is organized. So we have a GS1 global office, which is the one I work with. And then we also have what we call GS1 member organizations. Now, these member organizations are local offices that are positioned in 120 countries all over the world, including Kenya. And what the local offices do is really customize the global standards to the local settings. So this includes, for instance, conducting trainings, in cases where English is not the first language, the primary language, translating the material to the local languages, and really serving as a support for the local stakeholders. So we have a GS1 office in Kenya, and that's the one that Nelson is representing. So back to the standards. The GS1 standards enable the identification, capture, and sharing of information that is used throughout the supply chain. What you see at the top there, the blue part, is just a representation of some of the ways that the elements in the supply chain that are identified by the GS1 standards. So we have locations that are identified using a GS1 standard called global location number. We have products called identified using a global trade item number, and all the way to the far end we have another one called a GSRN, which is a global service relation number. So really the GS1 standards help you identify, they develop mechanisms to identify these items. So whether you are in Kenya and you want to apply your trade item, your product, or you are in Australia and you want to do it, to do the same thing, identify the product, GS1 makes it possible to make this identification in a way that is uniform. Again, if you're in China and you speak Chinese, and again, that's what the GS1 standards, it just really enables us to have one uniform way of identifying these supply chains and these components in the supply chain. And I think this component is very important, especially now, given how global the world is. People are moving everywhere. Even if you look at the Kenya supply chain, you probably know more than I do where the products coming into Kenya are from. I don't think everything is manufactured in Kenya. Obviously, a lot of it is imported as well. Some of it is imported as well. And what the GS1 standards do is to make sure that that identification at least is uniform. And then the important part is then for the community now, the stakeholders now, in this case the Kenyan team, to really organize and have and make the use out of this unique identification in a way that makes sense for the country. And we'll talk a little bit more about a specific use case later, but I really want you to understand this component. And what capture means really is just a simple way of capturing the identification information in a barcode so that it could be easily retrievable. As an example, if we say we're going to identify a global trade a product, a trade item, using a GTIN, we would allocate a series of, say, 14 digits. And what the capture does is really helps you capture that information in a barcode so that when you need to move those 14 digits into a computer system, you just scan and then it goes. So again, the pharmacist, or if you have any product in front of you, I invite you to take a look at the product, look at the barcodes, find the barcode and find the numbers underneath it, and boom, that's probably the GS1 standards inactive there, in action there. What I also want to specifically talk about when we're talking about the capture standards is that there are different types of barcode. We're probably very familiar with this one, the EAN UPC barcode. We're also probably very familiar with the GS1 QR code. This is what we used a lot during the pandemic with scanning QR codes left, right, and center. The one difference that I would also like you to that I'd like to invite you to think about as well is that when we're thinking about barcode types, we have a QR code and then we have a data matrix. So the QR code has eyes, right? 3 eyes up there, and then the data matrix doesn't. And then, of course, we have different types of other barcodes, EPC, RFID tags, etc., etc. In the healthcare settings, though, the GS1 data matrix is the one that is mostly used to identify trade items. We also have another one called the GS1128. It's a longer version. And we also have the EAN UPC. So for those of you that are working in pharmacies, you probably recall perhaps seeing a barcode looking like this one on the medicine pack. And then on the bigger shipment boxes, you've probably seen this one. And the products that are normally sold over the counter probably carry this one. So these are the 3 commonly used barcode types in healthcare today. So this is just a typical a pictorial presentation, again, for those of you who like me, learn better, retain information better with images. What we have here is a warehouse. The warehouse itself would be identified using a GS1 standard called GLN, Global Location Number. The product would be identified using a Global Trade Item Number. And then, of course, there's other GS1 standards that are used to share. And I will not bore you with the details of that one, but I think these are the critical ones, especially at this level of the conversation, that are relevant. I think I saw a few pharmacists as well, who are representing pharmacies. The pharmacy would be identified using a global location number. And then, of course, the product would be identified using a global trade item number. And then this is, again, a hospital. I'm not going to go into so much details, but this is really the GS1 standards in action. And what I want to say before I move on to the next part is really that the GS1 standards are there, and you are the user, and you decide how you want to use it. Of course, we have guidelines and tools and examples and use cases, and that's what we serve as well. So you could reach out to us anytime to hear about any of these implementation cases. But then I think it's really important for you to really own this and think about how the standards can make your specific use cases, needs, business needs come to life and fruition. And here are some of the benefits that have been reported by various users throughout the world today. There's the benefits in data quality. There's the benefit in reduced time and costs that are used to really verify data. So really looking at the idea, again, is once we have the necessary systems and processes in place, we can scan the barcode, and then the barcode just opens up a world of information. But again, it really requires all these other processes, like all these other stakeholders, to really work together and have the necessary processes in place. And then I think the one that is very relevant to all of us, we all care about it, is that it really contributes, the standards really contribute to improved patient safety and also improved healthcare outcomes. And a little bit more, actually I'll skip this slide and we'll talk about it later. So in the opening remarks, I did hear a few words around traceability, about track and trace, and I thought it would be helpful as well for you for us to discuss this traceability as a specific use case. So what traceability means, again, very simplistically, it's an ability to be able to trace a product from the point of manufacturer. So I'm talking about a best case scenario here, okay? Moving a product from the point of manufacturer up until the time it comes to the patient. So the best traceability systems in the world today are enabling that, right? So they're enabling at any point in time, I'm a consumer, I would have a law and application or something system I log into, and I will be able to take a look at the medicine pack I have in front of me and to be able to say, this one was handled by this many people, it went from the manufacturer, it went to the distributor, and then it was received at the seaport, and then it went to a distribution center, and then it went to the regional distribution center, and then it went to the main hospital, and then it came to the dispensing window where I picked the medicine from. So that's in best case. So traceability simplistically means, and this is a general definition, does not only apply to healthcare, but it just really means, and it represents an ability to track forward, to be able to say, this is where the path the medicine is taking, and then at any point in time, if there is an issue, to be able to look back at the chain and be able to say, okay, this is where the medicine has actually passed through. So track forward and trace backward. And another key component that is also coming up today in conversations, in global digital conversations, is that in the parallel, so as the product is moving, the information is moving. So the manufacturer manufactures, and then they share information to the distributor. They also share the product. Same thing applies. So the product, I think it's called the digital twin. So product, and then the information moves together throughout the supply chain like that. When we think about traceability, there are two critical distinctions, right? So there's one we call verification, and then one we have traceability. And today we have both cases in use in different countries in the world today. So verification, what it simply means is to be able to say at the point of dispense, like, okay, I am a pharmacist, I want to give a medication to a patient, I need to verify that this product is authentic. So there's all these processes and systems and to enable me as a pharmacist to verify this product before I issue this medicine to a patient. In that case, one example that comes to mind is the European Union. So within the European Union, if a patient goes to a pharmacy, before that product is dispensed to them, the pharmacist, whoever is dispensing, needs to verify against the European database. And then traceability is what I described. The track and trace is what I described earlier. And one of the super traceability systems that we always talk about is one from Turkey. And what they have done is really be able to facilitate that. So anytime a product starts from the manufacturer up until it gets to the patient, they have all this information and they are able to look, to track forward and to also trace backwards where the product was. And all of this done, all of this is able to do, and I'll tell you a little bit more about where it's actually been implemented, is being used by a GS1 data matrix, right? So the standard today, the harmonization that's happening today, the manufacturers and distributors, they're all harmonized behind having what you see on the screen. So they're asking, the regulators today are asking, we have over 70 different regulators around the world, and they're asking for the manufacturers and distributors to make sure that all the products, for the sake of traceability, all the products have a GS1 data matrix on it. And in that data matrix, the information that is contained is a unique identifier for the product, which is GTIN, Global Trade Item Number, the serial number, expiry date, and a lot number. So this is what 70 plus countries regulators are asking for, and that is also the call for the countries like Kenya and others who are still working on setting up their traceability system to also align behind this one. And I think we have another interesting case study that will be presented on how they have made this possible in the later parts of this webinar. But this is a critical component. So it's a GS1 data matrix. It's not a QR code. Remember, the QR code has eyes. This one doesn't. And then when you scan this barcode, the idea is to be able to retrieve this information. Just a quick reminder, if you recall earlier, I was talking about a global trade item number being identified using a series of numbers, right? So you have all those numbers, and what the barcode really enables you is to be able to retrieve this information and with a scan. So you scan this, and then boom, the information that gets displayed on your information system is here. So it has a lot of benefits. It's really saving us the time of manually writing GTIN. So now I write 088064000. Being human, I might get it right the first time, the second time, maybe up until the 10th time. But I promise you, by the time I get to the 90th time, there will be an error there somewhere, and that's what the scanning does. So it really is a simplistic way of transferring information from a product into an information systems, and of course that opens up again a world of opportunities and benefits. Yes, so as I was saying today, the data matrix is the choice of over 70 countries around the world who are setting up traceability systems, and they are aligned behind this one, and that's also one of the things that we also advocate for. And there's a critical, I think there's two references that I've included here. One is from WHO. They published a policy paper in 2021 that specifically aligns with what I was saying around a data matrix and GTIN and all those information pieces. And then, of course, there's the GS1 position paper that has that information as well, in a bit more detailed information. So you'll have access to these slides, and you could have a read at this. Especially the WHO policy paper, I really encourage you to read it. It has a lot more information about traceability, the nuances, and etc. So the situation looks.
Can anyone hear Nuran, or is it just me?
No, John, I think Nuran has an issue with our internet.
Yeah, I think we lost her via the internet. It might be lagging a bit.
You're back now.
Yeah, back.
I'm back. All right. Okay.
Yeah.
Sorry about that. Okay. Yes. So this is where I was. I was talking about the where the identification of pharmaceuticals is today. These are the countries that are using the GS1 data matrix. So the greens represents that they're using the GS1 data matrix. And in as much as Africa is a bit behind, as you could see, there's still no input available. It's still peach. I think that's the correct color. But I promise you, the way this map looked a short 5 years ago versus how it looks today is very different. So it means that there's a growing number. I think many of these countries. I think Nigeria's regulation just got published last year. They've done quite a lot of work in the recent 2 years. Ethiopia, of course, has been around for some time. I think Zambia, so there's quite a lot of very steady developments. And as I understand it as well, Kenya is definitely moving along these lines as well. And this is a little bit more detailed information. So the greens represent the countries that are today asking for the GS1 data matrix with the GTIN and all those information, the 3 pieces of information. And I think Kenya published, as we understand it, some draft guidelines end of last year, early this year or so. Zimbabwe as well, Ghana and South Africa has also been having these conversations for some time. And it would be amiss if we didn't talk even a little bit about some of the cost elements that go into this process. It's one of the bigger conversations. It's going to cost. How much is it going to cost? The truth is, it is going to cost something to make all of these processes possible, right? So the manufacturers need to make provisions for identifying the products, printing the identification information on a barcode, storing this information, and then sharing this information. That means anything that they have to do with, buying scanners and printers and all these bits and pieces. There's process enhancements. I think the process enhancements really cuts across. It's relevant for the manufacturers, for the distributors, and I think a large part of it also for the the majority, the government and their stakeholders, really talking about, okay, let's introduce scanning, let's introduce this many mechanisms of verification, let's make all these necessary systems in place and make all these systems interoperable so we could have one source of the truth. So these are some of the components, cost items that go into this. I must also mention that this is definitely not exhaustive. And it would vary really from country to country, from organization to organization, depending on what the country or the organization already has in place. I imagine there are a few local stakeholders. I think my colleague Nelson will probably share some of these cases that are already using data matrix. They're already identifying using the GTIN, the Global Trade Item Number. So for them, for instance, it will not be as heavy of a lift as it would be for a company, again, that doesn't have a manufacturer that doesn't have any of this in place. So in relation to cost, I also want to share some experiences from around Africa, particularly for the local stakeholders. I'm trying to anticipate some of these questions, but please do not hesitate to ask these questions in the chat. Or through other forums that will be laid out later. But what we've seen other countries, especially I'm talking about African countries, that have done to make the adoption process a bit easier. They have, and I think I had, I think I didn't have that slide here, but they have given the local stakeholders a bit more time to comply. Really saying that, okay, if we're asking the global manufacturers to comply within 2 years, to make sure that within 2 years, all of the products have the data matrix, et cetera, giving the local stakeholders a bit more time. So saying to them, okay, we're going to give you a bit more time just so that you have time to make the necessary investments, make the necessary learning. So that's one way of doing it. Another way of doing it that we have seen as well is by doing phased implementations. So saying, for instance, that they're going to start with piloting one specific product item, and then they will add more one at a time. So an example from Africa, I'll give you one, is from Nigeria, actually. So Nigeria had started by doing what they called a narcotics pilot, and this is public information, that's why I'm sharing it here. So they had done a narcotics pilot, and that's what they had started with. So really, the NAFDAC, the regulatory authority there, told their narcotics manufacturers and suppliers to make sure that all the narcotics had the GS1 data matrix with a GTIN and expiry date, lot number, and serial number, and that's what they did. So they used those learning to say, okay, this is how much how much time it took. It also gave the government and their stakeholders time to understand, make the necessary process setup, etc. And then it also, then of course they moved on to add more products. Another example from the Americas is Argentina. So Argentina, for them, they had also phased it up. They had started, I think, with anti-cancer medication. I don't know if that's the correct terminology. Please excuse me if it's not. And then they added more products. I think they did the phased implementation for, I think, over 4 years or something. So it really started with a small set and then added and then added and then added. So it gave really all the stakeholders. So the government could learn, but the manufacturers could also learn. So it really gave them time to learn and adjust and iterate. But then these are additional learnings that we thought are very important and relevant for you. Again, is having local champions for the countries that have successfully set up traceability. It's really an initiative that has to be owned by the owners, the government, the PPBs, the Ministry of Health, and it's not a one organization initiative effort. It really cuts across multiple organizations, as the second point over there shares. And in order to reduce the pushback or the differentiation with the global trends, it's alignment as much as possible with what's happening around the world. So really saying, okay, this is what they're asking for, this is what our peers are asking for, and that's what they asked for. And then another important part as well is to start from where you are with the existing resources and tools, and then to build and add a little bit more. And these are some of the common learnings that we've had. And now I hand over to Nelson to talk a little bit more about the GS1 Kenya experience and support on this space. Nelson?
Thank you so much, Noran, for that informative discussion. So as GS1 Kenya, we are actively on ground to enable our local manufacturers and stakeholders to actually achieve the vision of GS1 standards implementation. Looking at the supply chain of pharma, we have the brand owners who are the manufacturers in this case. We have the distributors or importers. Then we have the hospitals, retailers, and then at the end we have the patients. So as GS1, we enable all the stakeholders identify and understand the language of GS1. Most importantly, through membership, you know the first part of you being able to understand the GS1 standards and implement them effectively. As a brand owner who manufactures the product, you need the unique identifiers. For us to achieve traceability fully, we have to know what are the components that are being transported throughout the entire chain. And identification using global standards is very key. Looking at a simple question that we normally encounter in our discussions is, imagine a situation where every manufacturer was given the mandate to identify their products in their own way. There are high chances that you may find that there could be duplications. And given our country, most of the products that come in are actually imported. And GS1 as a body, we've been able to collaborate across the world. You find that we have a body in GS1 China, GS1 India, GS1 UK, and so on. So the medicine that comes into our region already is actually compliant with GS1 standards. We help the manufacturers uniquely identify their products using our standards. And then, like my colleague has said, we capture that information in a data matrix. Maybe to touch more on what she stated about the data matrix. The data matrix came out as the capture standard that has been recommended worldwide by the global parties and others that in this sector. Reason being, the packaging of pharmaceutical products is not getting bigger. You find that nowadays we have smaller and smaller tablets because technology is improving. We are trying to have a smaller packaging. The linear barcode that is most common that most of us are aware of, the one that has black bars on a white background, only captures just the unique identifier, which is the GTIN. The other information like the batching, the serial numbers, expiry date, the manufacture date were now just manually captured. This challenge actually, the pharmacists here can actually attest to it. When you receive consignments from your distributors, how are you able to capture this information and transfer it into your systems? Currently, there's no way. You are either do a manual Excel list, someone sends you the list, then you upload to your system, or you have to go per drag capturing this. So the data matrix came out as the unique data capture standard that enables us to embed all that information into a small code using application identifiers. Basically, application identifiers are just a set of standards that help us to define which kind of data is being encoded. You've seen most of the products that are currently coming into the country is, for example, even the vaccines that came in for COVID. Most of them already had the data matrix. They didn't have this normal linear code that we had. As GS1, we locally in Kenya, I can inform you that most of the manufacturers, the big brands you know about, are already compliant. They're actually asking us, GS1, how do we get other stakeholders understand? Because the products are already compliant. They come into the market, they already have this data, but maybe the use of that information has not yet been pushed forward so much. So we are actively engaging through trainings, first of all, to engage further and understand that, okay, what are we talking about? Why is this GS1 necessary? You know, as so on. Looking at the global space that we are currently operating in, we are no longer into isolations. We are in a global village. Everything now is interconnected. If a product is going to come from India, how are our local systems capable of communicating efficiently with this information? So GS1 as a body, using our standards of uniquely identifying and then capturing, we enable that interoperability. That someone who is importing today may not have any issue. The product you bring in, you just have to verify and you understand that this product is already coming with compliant identifiers that are okay. Noran, I lost the screen. I don't know if she's still on. Okay, let me just proceed as she comes back on. The other thing that we currently support on locally, we have various solution providers. Those are people who are offering you the systems that you use in your various operations, be it internal, pharmacies, manufacturing, and so on. So these developers or the people who offer you the solutions need to understand how are we able to capture that information effectively. Our teams collaborate effectively with them through understanding that if we talk about a GTIN, why is it necessary? How is it structured? How do I encode this information in my system that we are able to enable that language? We've been so successful in the field of retail, as you know. Right now, if I'm manufacturing, let's say soda, I don't have to be nervous whether Naivas will take my product or Carrefour. I just have to supply because already my product is compliant with a unique identifier, and all the rest in the entire chain are able to capture that information accurately. A key challenge we've been facing is because we've not had any key pusher or enforcement saying that no, we need to have structured data in this format. And most of the manufacturers will tell you, well, we need this, but if there's no driver for us to have it implemented, it doesn't make sense. But I'm happy that the conversations are ongoing, and I want to thank KAPI and the other key stakeholders on this call that are actively bring this discussion into effect. Touching on to serialization. Serialization came into effect as a component that is key for supply chain, reason being that the current mode of traceability internally was stopping at batching. You find that a batch and looking at how the products are manufactured. Some factories work in shifts. We have the people who work in the night shift, and we have the people who work in the day shift. So batches are normally follow the working shifts. The team that manufacture the products overnight, that is a unique batch. And then the other team that does the day manufacturing, they also assign another batch. But we were losing the component of being able to identify each item in that given batch uniquely. So serializing is a component that came out as a factor that is very key. That you find even if I have 2 paracetamols and a given batch, they are still unique because each one of them has a unique serial number. And me as a manufacturer or someone who is distributing this medicine, when I receive the medicine, I can be able to attest and know, okay, the serials I have are actually this and this and this. And this has been very effective in the area of technology. You find that machinery, spare parts, the guys who do telephones, computers, they already implemented the serialization in that they are able to identify and curb counterfeits and all things that are being falsified on the market. Because if you receive a consignment and you tell me that, Nelson, this is a product that I got from your factory, I'm able to confirm, is it actually my product? Or someone else falsified it, maybe because my brand is moving so fast. Some people, maybe manufacturing, the product is okay, but it is falsified. When you take the medicine, it's actually effective. But is it the actual product from that brand owner? Or it was someone falsified it to take advantage of my brand? So serializing came out as a component that was very key to enable us to go until the last product, like even the individual product itself. How do we enable it to be unique? So these are added things we are trying to push. We have the GTIN already embedded on. We shall have the batch number also included. Then we have the serial number. You see, if we have all those, and then we have the date of manufacture and then the manufacturer date. So all that information is encoded properly, and then and we have it shared across the various systems through the various platforms that are being developed, but also existing platforms. Thank you so much, Nuran. Back to you. I welcome any discussions, future, and so on. Back to you, Nuran. Thanks.
All right. Thank you so much, Nelson. Yes.
Okay, you can hear.
Yes. So I have a quiz. Of course, it wouldn't be interesting if we don't do a quiz. So we're going to test your understanding of at least one component that we've been talking about all morning. So I invite you to take a look at, to open your phone. If you could see my screen. So if you go to menti.com and you use the code that you see on the screen. And if you can let us know which one of these is a data matrix. So one of these is a data matrix. Which one of it is it? So if you go to menti.com on your phone or device, and then you put in the code that you see there, 39791146. All right, I see somebody's already there, or at least somebody's. It will take a few seconds. I think we still have a bit of time. Okay. I think we have quite a number of results already. All right. Still some people think the other one is a QR code. Which one is it? So once you join, I see a number of people are joining. And the voting are going up as well. So I'll take a few more seconds and then we'll clarify. Okay. All right. So thank you very much for sharing your thoughts on these. I think the 78% win. Remember, the GS1 data matrix does not have eyes. It cannot see. The QR code, which is the one we've been scanning throughout the pandemic, and even today, I think if you go to some restaurants and some places, they still have the QR code. So this is a QR code. Remember, the QR code has the eyes. This is not used for traceability purposes. The data matrix is. So what you see, this one, the one that doesn't have eyes, is the GS1 data matrix, and it is the one that is being used to support traceability initiatives. So I hope that clarifies. A big clap for the 79% that got this one right, and maybe kudos as well to those that also contributed to this poll. So thank you for that. Sorry, I will sharing the wrong screen. I'll just do that again. Oops, no, share. If you have any questions around that one to clarify further, please don't hesitate to ask. But that's pretty much it. You have both our contact information within the slides. You have our email addresses, both for myself and for Nelson. So please reach out and do engage us. Do let us know how we can support, how we can inspire the conversations in Kenya based on the experiences that we're seeing from Africa and also from around the world. We're here. We're very happy to share technical input, technical contributions to the conversations. Really happy to share any of those bits and pieces. So I see we have 2 minutes left, and there's a few questions in the chat. How do you do? Yes?
I wanted to request if you're able to remain on the call, and then we can take the questions at the end. Is that okay with you?
Absolutely. Yeah, we're here.
Okay.
Yeah.
Thank you. Okay.
Thanks, John, and thanks everyone.
All right. We are taking note of the questions. Of course, some of them, if it's possible to answer them on the chat, let's do so. Towards the end, we will also open the floor so that we can also have more questions. So thank you, GS1 team, for putting a good foundation on today's discussion. We learned many things from your intervention, including that this is a progressive process. It is multi-stakeholders. It's a chain that every responsible stakeholder along the way needs to play a role. Thank you also for sharing some insights from your wide experience from other places, how it has worked, on what we need to look out for. Now, to give us a bit more insights, we have the team from NBI, that is National Bioproducts Institute from South Africa. It's a local organization or local manufacturing company in South Africa. And with us today, we are privileged to have Meryl. Meryl is a pharmacist who has been in the organization for the last more than 30 years. So she has wide and broad experience in quality assurance and pharmaceutical manufacturing. And together with her is Sean Pile, who is coming from Pyrotech company, which is a company which has implemented track and trace solution for NBI. So with that, I would like to request you, Meryl and Sean, to make your presentation. And I request everyone to keep putting their questions on the chat. We will address them at the end. Over to you, Meryl and Sean.
Great. Thank you, John. Thank you for the introduction and good morning to everybody. And thank you, Naran and Nelson, for your input as well. I can hear that you are both experts in the field, so bear with me. I'm not an expert in the field, but I'm certainly going to try my best to give everybody who's listening a sort of a practical approach to what NBI has done. But just by way of introduction, please, I'd like to introduce NBI as an organization. So we're a non-profit organization and we manufacture, sorry, let me just open and share my screen while I'm doing this. Sorry, can you just confirm that you can see my screen?
Yes, we can see your screen.
Great. Lovely. Sorry about that. Okay, so just by way of introduction, NBI, we are a non-profit organization and we make human plasma-derived medicinal products. These products are marketed and sold to reach South and Southern African patients. And they're also registered in Botswana. We've registered in Namibia and Mauritius as well. And all of our products are intravenous and intramuscular products as well. So they are pharmaceutical and of a diagnostic nature as well, just by way of introduction. So I thought I would start by just giving you a few tips on how NBI has approached this track and trace challenge from the start, because I think it can be quite a daunting exercise. There's a huge amount of information that's available from GS1 and one has to sort of filter through it and start somewhere. So there's quite a lot to take in. And I do apologize if some of the information is overlapping with what Nuran has presented, but I think it will still be useful anyway to go through some of it again. So from our perspective, to purchase a system off the shelf is quite a costly exercise. So from a non-profit organization point of view, we're always looking at better ways to do things locally, to cut costs and so on. And I'm sure everybody in Africa is thinking in the same way. So let's get started with just a few tips that we did at NBI. So the first thing that we did was really to try and understand the GS1 terminology first. And Nuran has covered quite a lot of this already. So she's already spoken a lot about the 2D data matrix barcode, so I won't linger too long on there. But I want to talk next about the application identifier, which is quite interesting because yeah, and you need to be quite aware of the information that is required to be coded in your 2D data matrix barcode. So in the little picture in the middle of your screen, you can see there that each alphanumeric text is accompanied by a bracketed number, and that is your application identifier. And this is very important to have this information so that when you scan your 2D data matrix barcode, this information is preceded by the alphanumeric text, which is specific for example, the GTIN number or the expiry date and the lot number and so on. So that's an important terminology to understand. The next thing to understand is the human readable interpretation part. So this is the information that is going to be printed generally adjacent to the 2D data matrix. And this is all the information that's going to be encoded in your 2D data matrix. So that is always printed adjacent to the barcode. Then there's what they call the non-human readable interpretation information. And this is information that additional information which may be useful to your customer or your patient or the end user, because it's not always obvious. And what we found was the GS1 format for the expiry date and the manufacturing date, the year, day, month format, can actually be quite confusing for the end user. So that in our circumstance, it's important for us that we have that information printed in a format that is understandable by the end user or the doctor or the patient and so on. So we've chosen to include additional information that is not encoded in the 2D data matrix, but is actually printed on the product as well. The next useful piece of terminology is the GTIN 14, which is already Nuran has also covered. So I've included there a little breakdown of what this number looks like. You can see the 14 digits. There's an indicator digit at the front, and the last digit is a check digit. But part of the code or the numbers are made up of a series of numbers which are specific for your company. So it's your unique company number, and then the rest of it is the actual item number. So it's important to understand how that number is actually made up. And then finally, what's also important, another piece of terminology is the serial shipper container code, SSCC, which is another barcode which is usually included, certainly from our perspective, is included on our logistics unit as well. So I think that's quite important information to understand at the start. So the next part to understand and to do is to really determine the different levels of packaging or your packaging hierarchy. So we're lucky at NBI that our hierarchy is actually quite simple, and it's really only in 3 levels. But just to explain what I mean, it's important to understand your primary and your secondary and your tertiary packs and so on. So in our case, our primary pack is the bottle, and in which the product is packed. So the product is contained and is in direct contact with the container. The secondary pack, so we're just going back to the primary pack. It's not actually necessary from our perspective to do any data matrix coding on that primary pack, okay? But what is important is on the secondary pack. So that bottle gets packaged into a carton, and that's what we term our secondary pack. And then that secondary pack is then packed into what we call a shipper or a tertiary pack. And yeah, that is basically our logistics unit. So we really only have 3 levels, which makes it relatively simple. But obviously, you can go up to pallet level and bigger packages after that. So the next thing that we did was to identify and to understand which are trade items and which are logistics units, because that's important, because the information that is printed on each of these types of items is different. So your trade item, and in our circumstance, is a single unit, which makes it quite simple for us. So this is the item that is priced or ordered or invoiced at any point along your supply chain. So your customer would order a trade item. So it may be a single unit, it could be a shipper case, it could be a pallet, okay? In our case, it's just a single unit. And then the logistics unit is your item, which is really, it can also be a trade item as well, but it's really just it's a unit which is established for transport or storage, but it still has to be managed in your supply chain. So that's important to understand and to classify what is a trade item and what is a logistics unit. Then the next thing is to assign your GTIN 14 numbers to your trade items. And so there are many different rules around GS1 guidelines and GTIN numbers, but there's a load of information out there and guidelines that you can use, that rules around different languages and packages and brands and so on. So one really needs to get to grips with when an item needs a new GTIN number, for example. I've already explained the makeup of the GTIN number as well, in terms of it containing the company prefix, range of different numbers. So when you get your GTIN numbers from GS1, it will probably come in a sort of a little database like I've indicated here. And you'll see, if you look at this first row, number 1, this is a range of GTIN numbers, which we will assign an article number for each one of those. So for example, for item number 1, it might be product A, the secondary container for product A, and then all of those, that product A goes into a shipper, which is now would take on this GTIN number, the second GTIN number, and so on and so on. So you can then, we purchased a set of numbers from GS1, and then we've just allocated those numbers to our different trade items. Right, and then next, I think what was important for us was really to determine exactly what information needs to be printed on each item, both the human readable interpretation and the non-HRI information. So to do this, you really need to take into account, one, the GS1 guidelines, of course, your regulatory authority guidelines, any government authority, and also your trading partners, because your trading partners might need slightly different information on their products than what we do locally. So some of the, I've listed there as well, just some of the common HRI information that would be required. And I think Nuran and Nelson also mentioned all of this as well, but those AI numbers you see on the left-hand side in brackets adjacent to each of the different most commonly printed HRI information. So from our perspective at NBI, because we are medical and we are health, or we're healthcare products, but we're also biologicals as well. So we've been asked to actually include the GTIN number, serial number, expiry date, batch number, global location number, and the manufacturing date on our secondary containers. So there's quite a significant amount of information that needs to be encoded into this 2D data matrix barcode. So then I've also included some information that may be applicable for trading partners. For example, other non-human readable interpretation information might be, for example, like a price or license number. In the case of diagnostics, perhaps symbols might have to be included, and so on. So these are all things that you need to think about when you're actually designing the system. So I've also included just a couple of examples of what a label might look like. The one in the middle there just indicates there's a 2D data matrix with all the information that is encoded. And then on the left-hand side, information which we felt might be beneficial to the end user and more easily readable. Yeah, and it just gives you an idea. The bottom right-hand one, you can see symbols have been included as well as being useful for diagnostics. And then, of course, you have to look at your package and take packaging considerations into account. Obviously, this little barcode, even though it's relatively small, the more information that you put into the barcode, the bigger it gets. So you have to have space on your package, and that may mean some adjustments and changes to your packaging design. You'd have to look at the position on the pack for readability and so on. You can also, you might have to look at different formats as well as to where all the printed information is printed in relation to the barcode. So there's some examples on the bottom that you might have to take into account. If you have special storage conditions, you need to look at that as well in terms of ink durability. You don't want your ink to smudge when your product is stored at 0 degrees or colder than that, for example. We found that printing onto an unvarnished surface made the ink more durable and more readable from the camera's point of view. And then, of course, you have to look at the integration with your packing line as well, and how automated your packing line is. Luckily at NBI, we are a relatively small company. We have relatively small throughput, and all of our packing is actually packed. We pack everything manually, so it makes things a little bit more simple. So then finally, just looking at developing the system, because we've built our system in-house, we developed initially what we called a user specification, where we had to look at what standards do we need to comply with. That's important. If you're going this route, obviously we need to comply with current good manufacturing practice in terms of record keeping and process flow design and so on. GS1 standards, 24 CFR Part 11 compliance related to accuracy of electronic records and electronic signatures and so on. We have to look at health authority guidelines like SAHPRA, who's our health authority, and the Department of Health guidelines as well. So we're guided by all of their requirements. And then some of the other things we had to look at is how is it going to integrate with our SAP system? What information is required to be pulled through from SAP in order to make the system work? And obviously we have to have a system that can actually print on a variety of pack sizes and orientations and so on. We had to think about data storage and how we're going to recover data in the event it gets lost. All these, and how we're going to test the system and validate the system from a GMP point of view. So I think it goes beyond just the serialization and so on, but there's also the GMP aspect to look at carefully as well. And then we went on to a second phase, the functional specification, where we asked, how is the system going to work? How would we include authorization levels? What were all the testing screens going to look like? Line speeds, and how we're going to handle rejects and samples and the aggregation steps. So it's quite a large amount of information to get your head around. And then finally into the design specification and what would the architecture look like, the components, the printer, the layout, and so on. How is it going to fit into our packaging rooms and so on? And Sean from Pyrotech is going to address a little bit of this part. So we'll get some information from him as to how that works. Sorry, can I just stop there and ask, is everybody following me?
Yes, Meryl, we are following.
Yes, we're following you.
Okay, fantastic. Is it interesting so far?
So far, so good.
Yeah, no, it's good
and interesting.
Good.
Okay, all right. So what I'm going to share with you now is just a couple of little videos and some information to show you our practical system that we have developed. So the first one is the actual packaging line, and you can see by the picture there, our boxes are pre-packed. We have, the reason for this is that we have quite a number of components that go into our packages, and so it's very difficult to pack these things in an automated fashion. So we have packers who literally put together our packages and then will then feed manually these completed packages onto the serialization line. So there you can just see a package being fed on and onto the blue conveyor. And then let me play it, and then you'll be able to see how it moves through the system, and I'll try and talk through as we go. Okay, here we go. So there's a stopper initially, and the box passes a sensor, which will then trigger the initiation, the system to generate a serial number and to recall all the information that it needs from SAP, including the GTIN number and the batch number and so on. So there, the box is passing the printer. You can see the information is printed, then it passes the camera, takes a photo of it, and it's received by a packer on the other end. Would you like me to play that again, or is that okay?
Yes, you can play it again.
Okay.
It's a short video, so it's fine.
Yeah. Watch, did you see the camera flash there? If you watch carefully, you'll see it. There you go. So there's a mechanism, the camera and the printer are on the same frame, and it can be raised and lowered and positioned however you want it so that it prints in the correct place on the box. Okay, and then let's play this little video. This is now the aggregation process. So each individual box will now be scanned into a shipper. And then this is the aggregation process. So each shipper has a certain number of individual units that will go into it. And after the system has received the correct number of units into the shipper, it will then print a shipper label. So, oops, sorry. Something went wrong there. Sorry, can you still hear me?
Yes.
Yes.
Yes, we can hear you.
I don't know why it doesn't want to go. Okay. So there you can see each unit is individually scanned into the box, into the shipper. And there goes another one. Okay, so the position of the printed information is quite important as well. For us, it's not terribly important because it's a manual aggregation system. So each unit is picked up by the packer, scanned, and then placed in the box. But I think you can become a little bit more automated in the future. And obviously, you can have a camera that actually takes a photo of all of those individual barcodes and will then aggregate your box for you. So, but that would be a step for later and a much more costly exercise for us. Right. Let's go to the next one. Right. And then this is just a picture of our control system. And this is actually what the camera sees as the unit goes past. So if you watch carefully, you'll see here, this is the serial number, this SN here, and then this AI number, 21 is the serial number. So if you, and this is the GTIN number and the expiry date, and sorry, the batch number and the expiry date. So if you watch carefully, this number here, it will change. There we go. So the camera's just picked up another product that's come past. And then on the right-hand side of the screen, you'll see in a green box PP. And if it's green, the system says, yeah, it's all good. The barcode can be read, it can be verified, all the information is readable, and it's good to be aggregated. So that's the next step. And then finally, I'm going to talk you through. So this is our control system. I'm going to actually talk you through what happens and how it's set up.
Meryl, just a comment.
Yes.
Is it possible to share the screen while sharing with audio?
Can you not hear me speaking?
No. We hear you. It is the audio from the video snippet.
I thought I turned it on. I'm so sorry. Let me just see.
No worries. What you do, you stop sharing, and then when you're sharing, you share with audio.
Yeah.
Okay, let's do it again.
Sorry.
But don't worry, we are following keenly on the screen.
Yeah, but so you didn't hear me talking at all?
No, we hear you talking. It's the video.
Yeah, no, I know.
Yeah.
I'm talking on the video.
Talking on the video, okay.
Okay, let's just see.
Let's see.
Include sound. That's it. It's coming. Okay, let me go back again. So sorry.
No worries.
Okay, so you can see that. Sorry, I don't know. I think we're very slow on the side. Oh.
Okay.
Okay, let me try again.
Which requires a login.
Okay, can you hear that now?
Yes.
Okay, great.
And we have various authorization levels as well. So for operators, the pharmacist, and the administrator. Brings us to this screen, and this is where we will select the details of the product that we want to code and to serialize. So this is a list of our products. I'm going to select one. And then these are all the process orders that are available, which are pulled through from SAP to available to actually pack. So let's select this one, which is a test order. And it brings us to this screen and a coding test. So the purpose of the coding test is a line opening test, and it enables the pharmacist to ensure that the printer is working correctly and that all the details that are actually printed on the box are actually correct and that the camera can read the information. Once the coding test has been performed, we say OK, and it takes us to a line opening screen, which is specifically requires a pharmacist to open. Just gives a message to say wait while the system starts up, and it will actually start the conveyor as well. And it takes us to the production screen. And here you can see the name of the product that is going to be packed. It tells us how many units are going to be packed into a shipper. It gives us the GTIN code, the material number from SAP, the manufacture date, the expiry date, and the batch number. It also gives us the process order number. It gives us the count, the number of items that are expected in the process order. It gives us any rejects that might be rejected into the reject chamber. It gives us the shipper number. It tells us how many units or how many shippers we've scanned, and a whole lot of information that is required for the production process. On the screen as well, there's a place where we can take retention samples. We can also decommission an item. For example, if an item is dropped and has to be repackaged, we can decommission that number so it no longer exists, and put that item back on the line for packing once again. Then at the end of the production process, we simply close the line, which requires a pharmacist again. And it gives us an option to close the line permanently or to do a temporary close. Sometimes in the middle of the day, if there's a change of shift, or perhaps at the end of the day, we may not want to close the line permanently, but just only temporarily, then we would just say OK. If we want to close the order permanently, we say close the order, and we hit OK, and that's the end of the process. From then, the information, all the data that has been generated for this particular batch, will then be taken back to SAP and represented as a database. Right, did everybody hear that? Was it clear enough?
It was clear.
Okay, good. Okay,
Thank
then
you.
my final slide is just, so at the end of the batch, all the information is then taken back to SAP. And in front of you here is just what the batch record would look like. the first part that's in the green ring is information that comes from SAP directly. So that would include the order number, the material number, the batch number, and any other information that's sort of static information. And then on the right-hand side, you'll see there's an orange ring and a red ring. The top one, so it gives the status for the actual unit that was scanned, and it tells you the shipper that it went into. So the 8212 is the shipper that it went into, and its status is okay, meaning that that particular unit with this particular serial number will be in that shipper. And then you can see also in that same ring, there's a rejected one. So you can see the adjacent number is missing. So that reject never made it to a shipper. It was never scanned into the shipper, but we will find it in the reject container. And all of those rejected items then are then taken back and repackaged on the line and given a new serial number. And then the bottom of the screen, you'll see a red ring there that just shows items that have been decommissioned. So once again, they've been flagged. If they've been taken off the line for any reason, been decommissioned, that number no longer, it's still in the database, but it is no longer available. That product does not make it to a shipper, but that item, if it's damaged permanently, if the product is damaged, it will obviously be discarded. If not, it was just the package, the outer package that was damaged. We can take the contents of that package and repackage them into a new container and give it a new serial number. So this database then ultimately would be available for anybody else, for the patient, for the wholesaler, to continue the track and trace process. So that's really all the information that I have to share with you. I'm happy to take questions at the end, but I know Sean will also give you a lot of information further about the system that we have at NBI. So I hope that was useful to everybody. Thank you. Thank you,
Mary.
John.
That was super useful and helpful. So just stay on the line because there will be certainly questions, and I see already some of them. You could also start to answer them on the chat. We're taking record of that.
Sure.
And now I want to hand over the floor to Sean from Pyrotech to show us also from his perspective how they do this. Sean, over to you.
Hi, good morning. Thank you. Let's get my system going.
Sean, can you increase your volume just a little bit?
Dan, can you hear me clearly?
Yes.
Okay, perfect.
Proceed now.
Perfect. Good morning to our host, fellow speakers and valued listeners. My name is Sean Pillay. I'm the General Manager of Packlink Projects and Exports Africa, specializing in smart factory solutions and encompassing track and trace initiatives. Thank you to our host for the opportunity to share some insights into our projects and most specifically on the serialization and traceability. At Pyrotech, we're proud to have been in business for the last 59 years. We have, just give me a second. Sorry, my slides are not. Sorry. We have multiple centers across South Africa and partners of representation throughout the African continent. Our company operates through several specialized divisions. PackMark, which focuses on coding and labeling technology. Pack Media, our on-pack promotional labeling, including pharmaceutical fixed and forms labels. PackLink, which handles our smart factory software solutions. PackPrint is our high-quality lithoprinting division. PackWorks, our custom machine fabrication unit. And lastly, PackFinance, which is our in-house financing division, making implementation more accessible to our clients. At Pyrotech, our track and trace initiatives cater for serialization, anti-counterfeiting, and general product traceability, conforming to GMP. We have custom systems designed for multiple custom markets and regulatory requirements. Our focus today is more aligned around serialization within the pharmaceutical space. My colleagues GS1 and NBI have been through the code construction, legislation requirements governing the codes, etc. I'll focus more around the process, around serialization and the product and how to identify and how identification and verification occurs. So at PackLink, we offer robust track and trace solutions with integrated software and hardware systems across multiple environments, and you can see full traceability. That shows you real-time visibility, and that's what every customer is looking for today. NBI approached us with a simple but critical request to design and fabricate a serialization and verification on-pack printing and labeling system that not only meets all legislative requirements, but also integrates seamlessly with the ERP system, which is SAP. So the following slides will walk through the functionality of the track and trace solution and illustrate the data flow of the system. So I want to touch a bit on serialization. Meryl went through this, but I'll focus on the hardware and the data around these units. So serialization, applying a unique identifier on the retail unit of sale, conforming to your GS1 standards. Authentication, confirming the authenticity of the product or the unique identification code. We will go through that in later slides. And track and trace is determining the location of the product as it moves through our supply chain. So aggregation and inference, each item and case in the pallet assigned a serial number. The items are aggregated to your case level, which is your parent-child relationship. And then the cases are further aggregated to your pallet level, which is your parent-grandparent unit. Again, broken down or more simplified, serialization on a consumer unit. So you've got your data matrix code, consumer unit number, aggregation or parent-child-parent association is on a bundle unit, and we can further aggregate it to a case level, grandparent, and then on your pallet level, great-grandparent association. Now, if you go back to your database, you can see the traceability report, and Meryl has been to that traceability report at the end of her slide. You can see the pallet number, and within the pallet number, we've got the individual cases, and within individual cases, you've got your bundle units, and further down the line, you'll have all your consumer units. So GS1 has touched a lot on serialization around the coding and serialization that's occurring globally. Now, you have different types of serialization within the pharmaceutical industry, which we're particularly dealing with today. Serialization within the local environment, serialize the product that conforms to local track and trace within the manufactured unit, and sometimes move out to DC or consumer units. In the case of global regulations where your product is exported across multiple countries, then one would have to conform to the different global standards in terms of serialization and aggregation, which now has government bodies involved that actually supply the serialized numbers based on the countries that you're exporting to have a global database of all the numbers that are produced and tracked throughout the world. So as you can see from the different bodies, the EU body, the Chinese body, as well as I think this is the USA body. And later on, I'll leave my details in the chat, and if you require more information, you can communicate with me or drop me an email, and I can go through this in more detail. So with the NBI, what we've done in terms of the data tracking, our PackLink software connects with SAP or the ERP system to retrieve the correct master data and product data information. So SAP via an API or web service pushes the XML file to our PackLink database. And within our database, we would then update it and ensure consistency and traceability. The database sequence is used to generate the unique serialized number, and this is also done according to the set of rules or the customer set of rules. So again, NBI has their own set of rules in terms of the way the serialized number is constructed, and we conform to that. So aggregation rules applied in terms of the case, etc., as per predefined hierarchies, which is item, box, pallet. And lastly, PackLink generates a label format using the serialization and the aggregation rules. So as Meryl showed you in the videos, the SKU is selected via the HMI. Now here, the operator or pharmacist select the SKU variant, and this occurs after all the login user verification steps have been followed. And again, once the SKU is selected, PackLink requests the database or the data from SAP, which pushes the data through. The database or the data is processed. The label is created, again conforming to this customer set of rules. So the serialized codes are created and follow the GS1 principles. The information is being dumped to the printers. It's being sent to the camera system, which does the verification. And I'll go through this in more detail in later slides. Again, the case or shipper scanner will scan the information, push it back to the database, where the database then the software will then create the aggregated code for the outer case label. And once the case label is affixed, it goes into stores or warehousing, etc. And here, cases or pallets can be broken down and re-aggregated as per, again, the general set of rules. So going back to the hardware solutions, we have the printer or camera system, which interfaces with our database. We dump the information down to the printer to print the relevant information. The same information is sent to the camera, which has the different capabilities, OCR, OCV, which will scan and verify the label on the product. The verification process occurs within the camera to ensure that the correct text data is readable and accurate. Unit level verification, the system proceeds to aggregate, grouping the different units, cases, etc. And each level of aggregation is verified and encoded as per the hierarchical serialization logic. So once all of this is completed, the labeling and aggregation follows the processes. PackLink will then push the data back via an XML file with all the serialized aggregated data to SAP, and this will eventually close the loop to ensure that all records reflect actual packaging operations. So again, SAP sits on the local server or the cloud or any of your ERP systems. The data is pushed by the web service to our PackLink application. Once the SKU is selected, automatically we will dump or send the information down to a printer, camera system, handheld or automated scanning devices, and this could be a normal case or shipper printer or an automated printing system along the line. So how does the verification or camera verification occurs? So camera systems are equipped with embedded AI or software tools that perform automated inspections, which will read, interpret, and validate your printed text, your barcode information on products. And this is essential for data accuracy and compliance within your different packaging or production lines. Now, on the left-hand side, you could see a screen. You've got a camera system that's reading the information of a pack, which has got your barcode or QR code or a data matrix code, and it's got your human readable text. So you can see all of the human readable text is highlighted, and you've seen that in Meryl's videos showing the serialization process. So within the camera system itself, we have two essential tools that are used to read and verify the human readable text. The first tool is what we call OCR, and the second tool within the camera is called OCV. Now, what is OCR? OCR is optical character recognition function within a camera. And this converts your printed or etched text on a product, example, your expiry date or batch numbers, into a machine readable or digital data. So this is your normal text that one would see. The camera takes a picture of this, and this is where the processing occurs within the camera to identify your characters. So it recognizes each character shape and translates the visual representation into your alphanumeric text. So here you can see the same information within the camera using an OCR tool within the unit. It identifies the characters as 1, 2, 3, A, B, and C. The second tool within the camera is called optical character verification, or OCV. Now, the OCV tool validates the correctness and quality of the printed data against the expected content or the expected string. So in the previous slides, I've went through the information where our packlink software creates a label data and sends the label data down to the camera itself. Now, in the camera, the OCV function uses that data and validates the quality of your print. So the quality encompasses a whole lot of different processes where it checks the content, the structure, the visual information. It can also look for smudges, missing strokes, deviations. There's a lot of parameters that one would set within the camera to identify and look for the correct information based on the set of rules. So the same information that we've read on the previous slide, where the OCR portion of the camera or the tool identified the information, the alphanumeric text. Now the OCV performs its function where it'll identify the individual alphanumeric characters against its predefined parameters. So we could look for quality. We could set it from anything from 50% to 80%, and depends on what you want to see on that. Now, if you look at this image, you can see that the ANC has failed on this system because it didn't conform to the requirements or the preset values. In layman's terms, a product like this would be passed by the naked eye. So an example, especially in the pharmaceutical space, why we utilize OCR or OCV technology. If you look at a box of medication where we've got a date 7th month 2023. Now, to a person with good eyesight, it'll look at 7th month 2023. But a person with, or an aged person with diminished eyesight might look at that, and the date could resemble 7th month 2026 or 7th month 2028, thereby taking expired medication which cause harm to them. So therefore, the tools within the OCV looks at that and ensures that it meets the standard that's set out. Like you can see here on the right-hand side slide, ABC 1, 2, 3 could be a pass, but it failed because of the predefined rules. Again, all of this here because it doesn't conform to the requirements in terms of the formation structure, etc. So the verification process, in summary, the camera captures the image of the printed area on the product. It's got the two set of tools, which is OCR tool extract the data and digitizes it. And the OCV tool compares the extracted string to the predefined parameters that's set within the unit itself. So the date, format, allowed values, etc. If the content matches the expectation, the item will pass. If there's any discrepancies or quality issues found, then the items are flagged for rejection. Early on, GS1 spoke about anti-counterfeiting. And anti-counterfeiting is a huge problem across most industries, and in particular, the pharmaceutical industry. The funds or the money that can be made from anti-counterfeiting far exceeds funds that are made in illicit trade. And therefore, a lot of people are counterfeiting products. And the one sad part is your life-saving cancer medication, which was most prevalent recently in the black market where it's being counterfeiting. And I think it's more the chemo medication where you're buying placebos on the black market, and that's quite sad. There's a lot of anti-counterfeiting initiatives that are around serialization, aggregation. We have different tools that are used for anti-counterfeiting around serialization, where we've got specialized camera systems that will serialize a normal EAN barcode that look
Hi,
for
Sean.
deformities. Yes.
Sorry for interrupting. Yeah, we have 1 minute.
Oh, sorry about that.
Yeah.
Okay, I'm almost done. So again, lastly, RFID with serialized product tracking traceabilities. This is one of the stages that we have in terms of authentication. We can utilize RFID. RFID chip is embedded onto a label, and as it passes to the printer, the UID number on the chip is encoded and captured and linked to the corresponding serialized number on the central database. Again, if anyone is looking for more information, I'll put my details in the chat and we can chat further about this. Yeah. Paratech accreditations and legislative bodies that we've been accredited to. But thank you very much for the time. I know I've run out. Again, thank you to our host for allowing us this opportunity.
Thank you very much, Sean. There's quite a bit of questions in the chat.
Yeah.
So as we welcome our final speaker for today, you could also try and respond to them.
Okay.
And the same goes to Meryl, Nuran, and Nelson.
Thank you.
So
Thank you.
at this juncture, I'd like to welcome Gideon Murimi from the Pharmacy and Poisons Board to also share his presentation. And Murimi, you have 10 minutes, after which we will go through the Q&A and close the call. So over to you, Murimi. Murimi, if you can hear me. Could you, Lois, could you unmute Murimi? Are you able to share your screen, Murimi? Okay. Lois, please intervene. So as we wait for Murimi.
Able to speak right now.
Okay. Please continue posting your questions in the chat and in the QA function as works best for you. Our speakers are responding to them. Murimi, if you're back, can you hear me? Thank you, Sean, for sharing your contacts. And there are a few questions for you also in the chat, so you can respond to them in the meantime as we wait for Murimi. There you go. Okay.
Okay. Good morning. I hope I'm audible.
Yes, good morning. We can hear you.
Yeah, thank you very much. So I'll just take you very fast. I understand I have 10 minutes. which is quite retro, taking into account very many slides. So the outline is basically simple. We are looking at the history of traceability, current status, proposed pathway. We have 3 phases, then product coding standards that we are going to use, and then the strategy to be used in our case. So without going into a lot of details, I think many people who have been following have seen this slide before. So it is track and trace was actually started by Parliament in 2019 because of multiplicity of marking systems. And once that one was done, we were supposed to use the EGMS for track and trace that is used by Kenya Revenue Authority. However, this one did not take up, and so different agencies moved to develop one that was called IPMAS, which was supposed to be a collaboration of different agencies from the government. And that one went as far as drafting new rules for track and trace that went to Parliament, but by the end of the last administration, that one had not been done. So the only benefits from IPMAS is a track and trace like any other track and trace, but this one's supposed to be national and covers all products with one centralized mark. So current status is that it has not been implemented due to the lack of facilitating legal framework and financial challenges. So then we moved to the ministry one, MAPAC, which was a Medicines Availability and Pricing Advisory Committee, which proposed a track and trace solution. And by the end of the exercise, it had developed a blueprint for how traceability of products was going to be done. So the current status is that this one, we were able to progress, and batch traceability of products started, though we have not done the traceability itself. The batch numbers are being taken. We have now completely integrated with Kentrade, and we can now be able to get batches as they are coming into the country. And then we have the draft guidelines that were released on 21st of February this year. And I saw the presentation from GS1 acknowledging that we have draft guidance that have been presented, that we are waiting to go through other processes so that they can be adopted. And then now we are at the stage where we are engaging stakeholders in authentication and traceability, like what we are doing today. So what is a proposed pathway, which is now what is going to be critical to this place? So in this case now, since it applies to all registered health products in Kenya, our issue is to be able to uniquely identify, ensure data is well integrated and secure. There is interoperability between different systems, just like the previous presenters have shown different systems. And then we want to use a risk-based approach. And then, of course, the most critical is the stakeholder collaboration. So what is track and trace? So basically, tracking refers to monitoring the forward movement of goods, and tracing is doing it in the reverse. So the whole idea is that we can be able to get all the information of this product at any one point in the supply chain. So then if that is the case, what do we want to do in phase 1? So in phase 1, which is supposed to happen between 12 and 48 months, should focus on basic feasibility and recall capabilities. That means we can be able to track, we can basically be able to tell where our products are. And in case a recall is done, we can be able to perform the recalls. That's why we have the tracking, the feasibility, and the recalls, the tracing. So the requirements in that case will either, if you have GTINs, batch or lot number, and expiry dates. So there will be data capturing events, there will be data transmission, and then something that we're introducing is a central batch repository. For the local manufacturers, they have been using this one, and now it is being extended to imported products. So the deliverables is having GTINs and packaging guidelines, which now are currently in draft. Then at least we can do batch level data submission specifications, where people can be able, the manufacturers can be able to submit their batch information. Then, of course, operationalize the batch repository, and then stakeholder training. So in this case, we should be able to have batch visibility. We can be able to track at least the batches. We can have recall capability, and above all, stakeholders are fully aware of this process. So that's what you're supposed to achieve in the next 12 to 48 months. Now, in this case, what are the roles of everybody? So manufacturers and importers is to declare and report the batches that you are either importing or that you are manufactured. Number two, record and submit transaction data as it is moving around for the distributors, that's wholesalers. Retailers maintain receipts of records. Then for PPB is regulate, monitor, and manage the batch repository. Then we have the DHPT through government and the public. This is policy, training, and awareness. Okay, phase two, which is now 48 months to 72 months. This one is where we shall now focus on unique level traceability. Remember, once we are able to implement the system in 12 months, we need to give ourselves between 12 and 48 months to be able to see that we have concretely implemented the system. Then now there is 48 to 72 months, where now we have now unique level traceability. Once you are through the batch, now you should be able now to move to this point, whereby now, at this point, you are required now serial numbers on high-risk HPTs. You saw when they were demonstrating, GS1 demonstrated that I think there was a second, the second presenter who was also demonstrated the data matrix. And they have also explained it. They have also explained it very well, the difference between a data matrix and a QR code. And you can see in this case, we are using a GS1 data matrix. So one of the things that happens here now is the serialization and aggregation. I'm going to show you how that one is done as a key deliverable of this point. Then it will be event-based reporting. That means it is as events are happening, the reporting is done directly. Remember the previous one, it is a batch, it's just traced towards the patient and back. But in this one, it's as we move along the supply chain, we can be able to trace. Then at this point now, everything goes through authentication systems, which means anybody who is logging in or logging out, accessing the system, the regulator can be able to see. So what do we have here? Remember in the previous one, we had just a batch repository, but here now we have a serialization and aggregation repository on top of the batch repository. There's of course public app, which is now universal for everybody. The other ones we shall allow for, of course, different apps. Then of course there will be enforcement devices where inspectors will be expected to have some certain devices that are unique. Now at this point, you shall have different SOPs and regulations in place. Now, what do we intend to achieve? Now, this is unit level traceability that you can uniquely identify each dose. The public will be empowered to be able also to do the detections. And then we hope that we can be able now at this point now to clearly distinguish between what is supposed to be in the supply chain and what is not supposed to be in the supply chain. Remember, in the batch, you may not be able to achieve some of these items. So what do we have here for the manufacturers as their role? One is serialization and data reporting. Distributors is now serialized transaction management. That means per each dose, you do the serialization. And since you have aggregation here, it means you can still serialize an aggregated container, pallet, or box. Then the distributors can break it down. Then for PPB, of course, is the aggregation repository is added, the app and giving training. Then for the government, this now is infrastructure provision, usage, and public, we expect feedback from the public. In phase 3, which is now 72 to 120 months, focus will be universal serialization, advanced analytics. This we are now with advanced analytics. Here we have now AI coming in, where we can be able to use AI to determine some certain patterns and do enforcement based on these patterns. So integration with other system, which is of course carried out from the previous one. Then at this point, we need now to have international interoperability, where the track and trace solution in Kenya can be able to track across countries. So at this point, we need to have a mature authentication and traceability system. We need to have data analytics dashboards, and this is where now we have the stakeholders really interested in finding out what is the data that is being kept about their products. Then, of course, we shall have implemented global data exchange protocols that will provide now for traceability across the globe on a seamless system-to-system traceability. So as achievements, this one will be a secure HPT supply chain. Now you can see we have now data-driven regulation. That one lead into brackets AI, and then of course international credibility. So to achieve that, how now do we do the coding of the products? Now, I'll not go into a lot of details, but I'll just repeat what GS1 and the previous presenters have done. If you look at the GS1, you heard about the two codes. We have the GS1 128, which is the barcode, and then we have the GTIN, which comes with the data matrix. Both of them carry the same information, but in different formats. So in this case, we shall be implementing global trade item number GTIN, which is universal. And of course, we shall have, just like the last speakers talked about the different items, ours we are focusing on item 01, 10, 17, and 21, where 01 is the identification, A101 is the identification of the product using GTIN. Then we have A110 and A117. This is batch and lot number and expiration date. Then the A121, this is serialization now. The serialization is what is now being done now in phase 2 and phase 3. In phase 1, we shall just be up to item number 1, A01, 10, and 17. And in some cases, we might not even have 01. We might just be having 1, 0, and 17. So how do these come into how are they done? Okay, this one is a bit technical, and I think just one has explained this one. So the GTIN basically is A1 plus 14 numeric digits. That means it's 01 plus a unique number, 14 numeric numbers. Then number 10 is, of course, A1 plus 20 alphanumeric characters for the batch number and the lot number. Then expiry date is A1 plus 6 numeric digits. And then finally, the serial number is A1 plus 20 numeric characters. And so that's how this data matrix is created. Now you can see the difference between a data matrix and a QR code. You can see this one does not have the eyes. The locators, actually, they are used normally to locate the orientation of the QR code. This one comes in that format it is. So you can see this one shall be expecting to see in a box, and I think this one has been put in quite a number of some medicines have this one. I know quite a number of what we shall be starting with is the GS1 128, but this is the ideal that we shall be having in phase 2. Where at the top, we can see there is the GTIN number. Then after that, we can now see the second one, which is the serial number, which is issued by that is the batch number, which is 10 batch number that is there, which is issued by the manufacturer. Then we can see the expiry date, and in this case, you can see it is 27/12/31. That means this product will expire in 2027 December 31st. Then the last one is the serial, is a serial that is now issued per each unit area. In your case, in this case, you can treat it like per dose. Then, of course, now in the aggregation is that now it allows you to scan the pallets uniquely and serialize the pallets, the containers, and then a secondary, tertiary packaging without having to open that container. So we may not need to open the pallets that are coming, that are being shipped in, but by not opening the pallets, you can still scan them and serialize. And since these numbers are aggregated, that means they go through a tree hierarchy. By scanning the pallet, we actually know which are the units inside that pallet. So now, what is our strategy? In this case, the first one is PMS pharmacovigilance integration, and this is where we are starting. So the purpose is to enhance safety signal detection. And in this case now, we shall start with either GTIN, serial, batch, and expiry dates. And what we shall be doing is reporting, automatic linkages, risk assessment, and targeted recalls. So in this case, our biggest achievement in the first 12 months, once we go through, is that we should be able to receive information that can be used for pharmacovigilance, signal detection, and of course, we can be able to perform recalls. I remember Dr. Troitich said that the recalls is because of enhanced surveillance. With this one, we expect even more recalls because, as you can see, most of it will be automated. So how is the enforcement being done? In the enforcement section, we expect roles to be played by different groups. We have the first one is Pharmacy and Poisons Board. We have then there is Digital Health Agency, that is the latest agency. Digital Health Agency is the one that is implementing systems for the ministry. One of them, the one that they have implemented is SHA and the SHA system. They are also now working on the health information exchange, where we shall have product catalogs and other different types of catalogs. Then, of course, now they are also the ones who are leading in software development for the track and trace systems. Then the next one is DCI. This is the people who do criminal investigations. We have Anti-Counterfeit Agency. We have KRA. KRA, we are even connected currently because of the batch numbers as they are coming in. Then there is customs sections. Of course, the tools you expect data logs, forensic traceability. That's how we expect this one to be kept. The data logs will be kept by the stakeholders and the PPB and any other of these other enforcing agencies. Then we should be able to do a forensic traceability of each and every items. We shall, of course, expect offenses to be dealt with, like invalid sales, data tampering. The one that I'm very sure that is going to be very common is data tampering. Then, of course, we shall have the different consequences, fines, imprisonment, forfeiture, etc. Now, we also have controlled substances and authentication and traceability specifications. This one is immediate serialization and aggregation. For these ones, they will follow a different pathway a little bit, where theirs will go through an immediate serialization and aggregation. These ones will have real-time monitoring from day one. Then there will be multi-party verification, different agencies and different personnel. Then there will be cross-agency access. And then, of course, zero tolerance to compliance. These being controlled substances, that I think comes obvious. So, in a nutshell, what do we have here? Number one, we should have a national authentication and traceability system, phases defined and implemented. Then, of course, we shall have multi-stakeholder alignment required. We have internal stakeholders, external stakeholders, and I think I don't know if I shall call them para-stakeholders or what kind of stakeholders. Then, of course, we have critical for public health, compliance, and global confidence. Then, of course, PPB at the center of the digital regulatory transformation. So with that, I think I come to the end of my presentation. This is just one of the famous quotes of why we need to task ourselves to achieve success even when things are very difficult. I hope I've not been too fast. I was hoping to keep the 10 minutes. Thank you.
Thank you very much, Murimi. Yeah, for the very detailed yet on time presentation. So we've had presentations from GS1 who led the foundation for the call today. Then Meryl and Sean showed us how it's practically working in the South African setup at NBI. And Murimi has just told us what our regulator, the Pharmacy and Poisons Board, is planning to implement. And we appreciate the first out rollout of the project. As GS1 said, yeah, this needs to be done in a first manner, and we implement as we pick the lessons, iterate, and proceed. So there are a couple of questions here, and I'll start with a few directed to Murimi and the PPB. So the first question for you, Murimi, is how does PPB plan to implement CBR for foreign manufacturers? So if you could respond to that, please.
Good. So CBR is a centralized batch repository. Basically, actually, it has even been implemented. That one is already there. And what happens with a CBR, a central batch repository, is that currently the local manufacturers normally log in and upload their batch data. Now, for the foreign, the ones that are being imported, we are capturing them at Kentrade. Remember, when you get to Kentrade, you are supposed to declare your products as they enter into the market. So at the declaration at the ports, before they are cleared by PPP to enter, one of the items you are actually declaring is the batch number, manufacturing date, expiry, and all that. And it is at that point where once you declare the batch number, that now the batch details are captured, and then your product is released into the market. That automatically moves now to the batch repository. And this repository is now shared with anybody else who is doing track and trace. Okay? So it will be captured at when you are declaring your cargo at the ports. It is you declare the batch number. Once you declare the batch number, it is captured into the repository and then shared to anybody who is supposed to do track and trace.
All right. Thank you, Murimi. Eric, I hope that answers your question. Yeah, that's very clear. Then another one for you, Gideon. Meryl asks, how would the repository work? Would serial numbers be purchased, or is the generation of numbers the responsibility of the manufacturer?
Okay, very good. And I was hoping that GS1 would have covered how serial numbers are generated, but I'll give you the PPB version of how the numbers are generated. So basically, let me see. Allow me to move very fast to where the code is.
Okay.
I hope you can see my screen. So basically the way numbers are done, let me think this one is the best. So the first number you're seeing on the screen is issued by GS1. So you become a member of GS1, you're issued with a GTIN number, okay? So when we shall be starting, of course, most of the companies, we expect them to have a GTIN at least for a start. Then the second number, remember, is your batch number, which as a manufacturer, you're the one who generates the batch number. Okay. Then the last one is the expiry. The third one is the expiry date. Okay. Then now there is the serialization there. Now this serialization can be generated in two ways. Now, for it to be recognized globally by everybody, that this serial number is recognized globally, GS1 generates the serials for you, or gives you the algorithm for which you are going to generate your own serial. So that section is controlled by GS1. That way the product is visible globally, and anybody who scans this thing can tell you what it is, what product it is, and which unit actually we are looking at. Now, if you want to become Morocco, which PPP can allow, because as the regulator we cannot block you from that, you can come with your own arithmetical, mathematical algorithm to generate unique serial numbers. The rule is that this number should not be repeatable, should not be a number that can be easily guessed. That means I should not be able to know that, like now you can see this number is PC 1, 2, 3, 4, 5, then 4, 3, 2, 1, Y1. Anybody will know the next one is 2, 3, 4. It is easily to guess. Should not be repeatable. So the only thing the serial number is should not be a number that is repeatable, should not be a number that can be easily guessed. Now everything else is provided for you by GS1. Now the difference here is whether you want to become Morocco, where you're only recognized by the boards, or you want to become global. You want to become global, you go with GS1 to generate for you everything. You want to become Morocco, you can generate your own numbers locally, which will only be recognized in Kenya. In that case, you can't export or import. They only be valid as long as PPB exists. Thank you.
All right. Thank you, Murimi. So yeah, Meryl, it's the responsibility of the manufacturer. So you decide to whether go with globally recognized GS1 serialization format, or you generate yours, using your own algorithm. So it's the responsibility of the manufacturer. So thank you very much. I see almost all the other questions have been responded to by our speakers. So thank you very much. But there is still one more here from Dinda that hasn't been responded to. Okay, Nuran has answered, yes. So are there steps being put in place towards regional harmonization of serialization requirements, especially within the African regulatory networks like ESC? So Nuran, yeah, could you please respond to that with a little more meat?
Of course, Peter, thank you. I think it's a very, very good question. So these conversations have actually not only started at the EAC level, so the East Africa community level, but at a Pan-African level. And I think this has been a very critical conversation starter, especially right now with the organizations such as the AMA, which I think only a few weeks old, has a director general that has been appointed. So a long form, yes, there's quite a lot of regional conversations happening. Really excited again about the developments in Kenya. I think within East Africa we have, I think Rwanda has already started, with regulations since 2 or so years ago. Burundi has a strategy. So there's quite a lot of individual country efforts that are happening. And now with bodies that like the EAC, the Africa Union, NEPAD, AUDA NEPAD it's called, and then the AMA, there's now regional harmonizations to try and have a more holistic response and to also support the countries that haven't quite laid out the foundation. Sorry, I forgot to also mention Uganda. Uganda has also been doing quite a lot of work around traceability in the recent years. So that's it. Thank you.
All right, thank you, Nuran. So I see all the other questions have been responded to. So thank you to Sean. There was a question regarding cost, and yeah, if you need to get a little more details, Sean and Sean's colleague have shared their details on the chat. Please feel free to reach out to them so that then you can also, get ready cost-wise for the implementation of the aggregation and track and trace. I'd like to, at this juncture, hand the meeting over to Dr. Mokoro for closing. So thank you very much to our speakers. Thank you very much to our audience. You've been very patient, and that tells you that, yeah, this topic is very important to us. We've had more than 200 that have stayed with us for almost 2 hours, and currently at 152 who've stayed with us for more than 2 hours. So thank you very much, and over to you, Dr. Mokoro.
Thank you, Peter. My colleagues, I want to take this opportunity to thank the government agencies that have partnered with us in this webinar, more especially Pharmacy and Poisons Board and the rest. I also want to thank the presenter associations and the presenters, GS1, NBI, and Pyrotech, and KAPI, members who participated in coming up with the elaborate structures in the webinar. Also thanking the non-KAPI members who present, more especially we have KPDA, we have FKPM, Federation of Kenya Pharmaceutical Manufacturers, partner associations and their affiliate members, KAPI members, professional colleagues, both local and international, and other international organizations and attendees that have partnered with us today. So I think we are all geared towards now the implementation. I think training is part of the roadmap, and the trainings will continue, and as we move into the implementation and see how we can partner with other government agencies to have the harmonization as shown as Nuran has mentioned. So thank you everyone, and have a nice day.
Thank you, and have a nice day. Bye-bye.
Thank you so much. Bye.
Thank you, everyone.
Thank you, everyone. Bye-bye.
Thanks, bye-bye.
Thank you, everyone. Bye.